Hello everyone, I am Dr. Deepa. Today we learn about the cubotal fossa. Cubotal fossa is the very important topic in the upper limb. This cubotal fossa is nothing but the triangular area which lies immediately in front of the elbow or anterior to the elbow. We study this cubotal fossa under the following headings, that is the boundaries of the cubotal fossa, the roof, floor, contents and the clinical importance or the applied aspect of the cubotal fossa. Firstly, looking about the boundaries of the cubotal fossa. Now this is the atlas view of the cubotal fossa once we expose the skin and the superficial fascia. This is the picture how the cubotal fossa is seen once we expose the skin and the superficial fascia over here. The boundaries of the cubotal fossa, as I said, it is the triangular space. It is formed by the two sides, that is medial and the lateral side, the apex directed downwards and the base directed upwards. The medial and the lateral side of the fossa is mainly formed by two muscles. Number one is the pronator teres and the brachioradialis. The pronator teres makes up the medial boundary. The medial border of this cubotal fossa is formed by the lateral border of the pronator teres. The medial border of the cubotal fossa is formed by the lateral border of the pronator teres over here, whereas the lateral border of the cubotal fossa is formed by the medial border of the brachioradialis. The apex of the fossa is formed by the meeting point of these two muscles, that is pronator teres and the brachioradialis, whereas base of the fossa is the imaginary plane which passes through the two epicondyles, that is the medial and the lateral epicondyles of the humerus. So this is about the boundaries of the cubotal fossa. The boundaries, to have a quick revision, is formed by the apex, base and the two sides. The medial boundary is formed by the lateral border of pronator teres. The lateral boundary is formed by the medial border of the brachioradialis. The apex is formed by the meeting point of these two muscles, whereas the base is formed by the imaginary plane passing in between the two epicondyles. Moving on to the roof of the cubotal fossa. The roof of the cubotal fossa is formed by number one, the skin. Yes. Once the skin is exposed, what we see is the superficial fascia. This superficial fascia of the cubotal fossa contains three important structures, that is the medial cutaneous nerve of forearm, medial cutaneous nerve of forearm. Number second is the lateral cutaneous nerve of forearm, and the most and very important is the median cuboidal vein. So these are the three structures which make up the part of the superficial fascia in the cuboidal fossa. I repeat, the superficial fascia in the cuboidal fossa contains structures, that is medial cutaneous nerve of forearm, the lateral cutaneous nerve of forearm and the median cuboidal vein. This median cuboidal vein is a communicating vein between the cephalic vein and the basalic vein over here. Yes, it acts as a oblique vein connecting these two veins here. So all these structures make up the part of the superficial fascia. Beneath the superficial fascia comes the deep fascia. This deep fascia contains one important aponeurosis which is known as the bicipital aponeurosis on its medial side. So the structures making of the roof are, number one is the skin, then next comes the superficial fascia containing the two cutaneous nerves of the forearm plus the median cuboidal vein. The third, that is immediately beneath the superficial fascia, is the deep fascia, and the deepest part of the roof is formed by the bicipital aponeurosis. So this is how the roof is formed. The floor of the cubotal fossa, when we look for the floor of the cubotal fossa, is mainly formed by two muscles. This is the atlas view of the structures making up the roof of the cubotal fossa, showing the median cuboidal vein over here and the cutaneous nerve, that is cutaneous nerve of forearm, medial as well as the lateral. As I've already mentioned just now, that is the floor of the fossa is mainly formed by two muscles, that is brachialis and the supinator muscle. Yes, these two muscles, that is supinator on the lateral side and the brachialis over the medial side, make up the base or the floor of the cuboidal fossa. Yes, the floor of the cuboidal fossa formed by the two muscles, that is above and medially. The floor is formed by the brachialis muscle, that is the insertion of the brachialis over the coronoid process of the ulna. Below and laterally it is contributed by the supinator muscle. The supinator muscle is one of the muscles of the extensor compartment of the forearm. So this is how the floor or the entire cuboidal fossa is resting upon, laterally by the supinator and medially by the brachialis muscle. Now, this is the detailed picture showing the brachialis muscle. Here lies the cuboidal fossa, the floor of the cuboidal fossa. We can very neatly see the arrangement of this brachialis muscle reaching its insertion, that is the point of insertion over the coronoid process of the ulna. Here, this is another picture where we can make out the attachment of the supinator, very beautifully seen, from the lateral epicondyle, which acts as a common extensor origin, reaching the upper one-third of the radius on its lateral side. So this is how the two muscles making up the floor of the fossa are arranged. The contents of the cuboidal fossa from medial to lateral side are the median nerve, which makes up the most medial content of the cuboidal fossa. Just lateral to the median nerve lies the brachial artery. Lateral to the brachial artery lies the tendon of biceps, and most lateral content is formed by the radial nerve. So these are the four contents of the cuboidal fossa. We'll just see in brief one by one. The most medial content of this cuboidal fossa is formed by the median nerve. Yes, median nerve, as I said, it is the nerve of the anterior compartment of the forearm. It leaves the cuboidal fossa by passing in between the two heads of the pronator teres. Next, just lateral to the median nerve lies the important artery, which we can see here. This is the brachial artery. The brachial artery, once it is entering the cuboidal fossa, the artery ends by terminating into its two branches, the radial branch and the ulnar branch. So it has got two terminal branches, the radial and the ulnar. So radial artery is usually almost superficial throughout its course, whereas the ulnar artery lies deep. That is, it leaves the cuboidal fossa by passing deep to the pronator teres muscle. Yes, it is this pronator teres muscle. It is this pronator teres muscle which divides the ulnar artery from the median nerve, which lies superficial to it. Yes, median nerve is superficial to the pronator teres, whereas ulnar artery is deep to the pronator teres. The lateral content to the brachial artery. The brachial artery is laterally related to the bicipital tendon, the tendon of biceps. The biceps brachii, which is the muscle of the arm, enters the cuboidal fossa to reach its insertion on the radial tuberosity of the radius. Just before the insertion of the biceps tendon, it gives away a fan-like expansion which is called as the bicipital aponeurosis on its medial side. The most lateral content of the cuboidal fossa is the radial nerve. It is not the actual radial nerve, but it is the superficial branch of the radial nerve. I repeat, it is the superficial branch of the radial nerve which makes up the lateral most content of the cuboidal fossa. Now here is the very easy diagram representing the contents of the cuboidal fossa. Yes, the most medial is the median nerve, lateral to it comes the brachial artery, then is the tendon of biceps, and the lateralmost content is the radial nerve. This radial nerve enters the cubotal fossa by passing between the brachioradialis and the brachialis. Once the radial nerve enters the fossa, it divides into the superficial and the deep branch at the level of the lateral epicondyle. Yes, at the level of the lateral epicondyle, the radial nerve divides into superficial and deep branch. The deep branch is called as the posterior interosseous nerve, which is the nerve of the posterior compartment of the forearm, whereas superficial branch, as the name itself says, runs superficial throughout its course. This deep branch of the radial nerve leaves the fossa before entering it by passing in between the fibers of the supinator muscle. So this is about the contents of the cuboidal fossa. Now in this picture we can just study a bit detail about the brachial artery and its terminal branches over here. As I have already mentioned, the brachial artery, once it enters the cuboidal fossa, divides into its two terminal branches, that is the radial and the ulnar artery. These two terminal branches, that is radial and the ulnar, gives some branches in the cuboidal fossa also. The radial artery gives one branch which is called as the radial recurrent branch. The radial recurrent artery is the branch of the radial artery in the cuboidal fossa. In the same way, the ulnar artery also gives three branches in the cuboidal fossa, that is the anterior ulnar recurrent, the posterior ulnar recurrent, and the common interosseous artery. All these recurrent and the interosseous artery participate in the elbow anastomosis. The terminal branches of the brachial artery, that is radial and ulnar, give some branches. The radial artery gives one branch, that is radial recurrent, whereas ulnar artery gives three branches, that is the anterior ulnar recurrent, posterior ulnar recurrent, common interosseous artery. All these make up the content in the cuboidal fossa. Here in this picture we can very beautifully see the branch coming from the radial artery, that is the radial recurrent branch, which is trying to reach the lateral epicondyle and take part in the anastomosis over there. Now here we can see the radial nerve entering the cuboidal fossa in between the brachioradialis and the brachialis muscle. This radial nerve, as I have already mentioned, divides into the superficial branch and the deep branch. The deep branch is seen passing in between the fibers of supinator to reach the extensor compartment of forearm. Lastly, talking about the clinical importance or the applied aspect of the cuboidal fossa. The cuboidal fossa is very important as it contains the important structures within it. The median cuboidal vein, which is present in the superficial fascia, is the favorite site or the very commonest vein which is selected for the intravenous injection as it is most easily accessible. The brachial artery pulsation in the cuboidal fossa is used for the auscultation and record the blood pressure in a person. And the knowledge about the anatomy of this brachial artery or other contents of the cuboidal fossa is very important in dealing with various fractures around the elbow, especially the supracondylar fractures. So this is all about the cuboidal fossa and their applied anatomy. Thank you.